What about the 5, 4, 3, 2, 1?
Hello, we are live. And Danny, can you plug my mouse back in because it stopped working and it needs to be plugged back in? Unplug it and plug it in. I had to do it earlier. Hello, everyone. Brad, talk, please.
Well, here we are. Are we going?
Yeah, we're live.
We are live today, Bob, Brad, and Mike, and we're going to talk about knee pain, 20 different ways to maintain and decrease the pain in your knee and increase the motion, strength, etc. So we have a little problem here with IT, but that's all right. They're getting it fixed up. I'm just going to go with a solo here for just a little bit. So here we go. Now, what we'd like to do is get some input from you people. You know, if you want to say hi, give us your name and the city or town where you're coming from. And we like to know that as well. You know, we're here and, you know, we're from Wisconsin and Minnesota, but we don't give our main town. I'm just kidding. Anyways, let's get on with number 1. Now, this is something that has been around for a while, the idea of strengthening your quadriceps too much. In other words, a quad dominant knee. And the reason that is, it causes problems with the hamstrings. Matter of fact, my wife is quad dominant and she had problems with hamstring cramping. As a matter of fact, once it was so bad it cramped up in this position, I had to take her to the ER to get it uncramped. Anyways, when you're working, a real common exercise that people do with knees is I think they do long arc quads. In other words, the exercise I'm doing right now on Mike, we're pulling up, strengthening the quadricep muscles. It's a great way to do it, but this is probably not the best exercise for it. We want to have something that also introduces hamstring strengthening. A weight-bearing exercise, I think, is much better. Simply squats here, and we're working quads, but the hamstrings are also engaged. It's a very functional exercise, so we're really looking at that. So maybe 10 squats like this. You know, if you have weak legs and you're concerned about not being able to control yourself, put a chair right behind you there. So if you are going down and you feel like you're going to go back, it will catch you. If this is very easy and you want something more challenging, you do not need the chair, you know, then simply body weight squats can be very effective. Just the thing is make sure your knees, oops, I got a little wire here. If you're going down and if you go all the way down, and you can do this, but if you have pain, particularly sharp pain in your knees, then you do not want to do it. You can work your way slowly into it, but don't irritate your knees, the joint itself, while you're trying to exercise the quads and the hamstrings. Mike, you got another one for a hamstring strengthener?
Well, I'm saying hi to Beatrice, who said she's from Connecticut, and Hippolota from Chicago.
Chicago.
And they say the right knee hurts more than their left. Well, I'm presuming you're either right leg dominant or you injured your right leg at one point in time, or maybe your leg goes in or out too much. But we're going to keep talking about knee strengthening tips for hamstrings. Well, there's a lot of different hamstring exercises you can do.
We just can't say that. Give them one. Give me one, Mike. Come on.
Well, I like doing
I like this one.
Yeah, a single leg deadlift like that. That's a good one there. Well, I was going to say I like deadlifting, and I also like hamstring curls.
So if you're doing this hamstring is working very hard right now, and I can feel it. So just doing this body weight can be nice. If this is easy, make sure you keep your back straight. Don't round over. Back straight. And this chair keeps getting in my way, and, you know, make sure there's no body behind you because you don't want to kick them.
I would say another good exercise people can do to get your hamstrings, your glutes, and your back is just a simple bridge, especially if you're having knee pain, because you don't have to be on your knees for this or standing or walking. So just some type of bridge variation is a good option. If you find this way too easy, you can progress to single leg, or you can put a band around your knees like this and work on pulling apart while doing it. You can also just hold this for like 30 seconds. That's a pretty good hamstring burner.
You could alternate kick and really, there, one.
There, stand so I can get you.
Yeah, I'll give you
a little closer.
Hey, we've got Carol.
We got a lot of questions popping in. We're going to keep talking about some of these tips, and then we'll get to some of the questions as we go on.
From Canada. Corinne from Canada. Excellent. I'm going to Canada this summer. Maybe we can see you up there.
Hey. Our next tip is actually swinging for your knees. So what we mean by this is if you're sitting on a tall surface, say, what do you like to say in your pickup truck bed there, or just a tall table or mat, and you just kind of let your legs dangle, and now we're not doing long arc quads, but you just kind of let your legs swing. It kind of adds this nice distracting stretching force to your knee joint. So if you're having some discomfort, that's another way you can try doing it. Do you have any more tips about this?
About dangling?
Yeah.
This is one of those that, if you do have a pickup, flip the bed down. I've done it with a number of times with people who have pickups, and you just sit there and allow everything to relax and do the swinging for, a minute or two. If you add a little weight or put on some heavier shoes, it adds distraction to the joint, and that can be helpful. You'll just have to try it and see which is more comfortable. Again, a minute or two is all you're going to need to do, and do that a few times throughout the day.
Our next tip is actually a technique. This is McKenzie technique, I believe. So you're going to need a towel for
Pam.
this.
Pam is from the UK, and she's watching all the way over there. Excellent.
What time is it in the UK?
Can you tell us what time?
We're not good at time conversion here. Now, this one you can do in a seated position, Brad could show, or laying down. But what you do is you take a rolled up towel, you put it in your knee joint, and what you do is work on bending your knee. What this can do is actually gap the knee joint itself. So it allows you to get more knee bending if you're really struggling to get knee flexion or bending your knee. So I just hold it in there. If I'm laying down, I just focus on bending the knee like this. Or you can even grab with your hands and put a little overpressure. Ooh, I really feel that. It feels pretty good.
Yeah, if it feels good, this is a nice one to do to give us some slight distraction. Don't do it if it creates pain. This is one way I do this one is in a standing position, because I like to do this for my hip and I can get the knee. And this is about the right size roll. Don't make it really thick unless the thin one doesn't feel like enough, because you don't want to overdo it. This is more than I would actually no more. This is okay, but I would not want to go any thicker than this. Oh, there, just popped a little bit and felt good. If it pops and it doesn't feel good, stop.
Okay. Diane just had a total knee replacement 4 months ago.
Ooh.
And it says these exercises are great for recovery too. Yeah, they are. A lot of these exercises we're showing work for pre-surgery or after surgery.
Yeah, this is a nice, simple exercise. All right, should we go to the next one?
Yeah, we can go to the next one, which is actually stretching your hip flexors. Now, people might be wondering, what the heck does your hip flexor have to do with your knee? But it has a lot to do with your knee.
Well, let's show them an exercise for it. Yeah, if the hip flexors are tight, you don't get you cannot extend the hip as you come through, and that can change because one of the hip flexors is the rectus femoris, which connects from the pelvis to the kneecap. So if that gets tight, undue pressure through the kneecap causing knee pain. Mike, this is one that oftentimes gets missed, this particular muscle. This exercise gets it and gets it very well.
So the stretch we can do, especially if you're having knee pain, is lie on the edge of your bed if your bed is firm enough, or you could do this on a countertop or kitchen table if you can get up there safely. So what you're going to do is bring both knees to your chest. So we commonly call this a Thomas stretch. But it's a Thomas test is a test, and a stretch is how you stretch it. Rick Olderman, our friend, recommends this a lot. So what you're going to do is bring both knees up to your chest. If I'm stretching the left side, I'm going to let it drop. If you're tight in your hip flexors, you may be stuck way up here. We want to be able to at least get to even or past even. Now notice when I bring my opposite knee up towards my chest, my leg is going to lift a little bit. That's my hip flexor. I want to try to keep this leg down. And then to stretch your rectus femoris, which goes over your hip and your knee joint, you need to bend your knee like this, and you're going to hold this for about 30 seconds. Make sure your leg is kind of in a straight line. You just don't want to veer off to the side weird. And then switch sides. So we're going to bring both knees up to the chest, and then we're going to switch. And you can do both sides 2 to 3 sets and stretch it for 30 seconds.
All right. Oh, I just wanted to mention a gentleman had 2 strokes, and the thing just kind of split, so I lost his thing. But he said he has left knee pain in the morning getting up. I have a feeling if that's your involved side from the stroke, that knee is getting positioned in a way that is irritating the knee, whether it's full extension, flexed, or perhaps rotated. So maybe when you sleep, use a pillow. Ooh, I just want to address this because I really want to help this guy out. So when you're sleeping, If you're a side sleeper, put a pillow between your knees. If you lie on your back, make sure you try to put one here, and hopefully you don't sleep on your stomach, because that causes some other problems potentially. So those two things can be really helpful. Get yourself at least 1 or 2 extra pillows and work with that positioning.
Zoe is an anesthetist in the UK. Oh, is that like anesthesiologist here?
Anesthetist.
Oh, anesthetist. I can't read.
Yeah, we're not English.
English is not our forte here.
Well, his anyway.
There was a question earlier that someone mentioned, Danny, about going down the hill. Danny is our guy running the behind the scenes stuff for us right now.
Someone said going down a mountain
cause
hiking,
knee pain.
Right. Those eccentric exercises put a little more stress on the muscles as well as the joint, particularly in this case, I would assume it's the patella or the kneecap.
Yes. So what you want to think about is, this is my mountain. It's a staircase. When you're going down, see how much my knee is going over my toe. See, my knee is in forward of my toe. So what you can do is work on eccentric step downs. So what you can just do is just go on a step, focus on going down, try to control it, and then back up. You can do repetitions on each side. If you're having too much pain, maybe try a shorter step if an option, or maybe just like a 2x4. But what you want to do is get used to your knee going over your toe like that, because you're not acclimated to doing that on a consistent basis. Actually, Ben Patrick has looked into this a lot, strengthening his own knees after having numerous surgeries when he was younger. But you can just develop strength this way. Make sure to do both sides. If you get really good, try not holding on and just try touching down. This is really a good workout to do.
Yeah, that's good. So you talked about varus and valgus.
We didn't talk about that.
Go right in here. Also, when you're doing this, or when you're hiking on the hill, this is just a midline, so use that for reference. As you bend your knee, a lot of times people's knee will actually go in, and that puts a valgus stress on the knee. That you don't need to understand that, but it will stress the knee. That could be the problem. So make sure your toe or your knee stays over your toes. So it's like this, not like this. And sometimes people go out, but usually in, and they're not even aware of it. So pay close attention to that little tip.
The other question we had about going downstairs, my knee hurts, the same exact thing we talked about with D going down the mountain pertains to you as well. You're just not used to going your knees over your toes like this. So strengthening in that range of motion in a controlled manner using your arms will help. If going up doesn't cause pain, notice my knee is kind of behind my toe and I go up, so it's not as problematic, but oftentimes it's that knee over toe translations people have issues with.
Robin, she's getting a new knee Monday, so good luck with that. We have excellent videos for pre-exercises and post-exercises if you don't have a therapist that you're directly working with. Those could be helpful, but we need to talk about...
Just take your time. Do not compare yourself to anyone else that had a knee replacement, because everyone's different, and most time, one motion is going to be harder than the other for you, whether it's bending or straightening, but just take it slow and do what your therapist says and the surgeon says.
There you go. Good recommendations. Hip abduction. These muscles right here have a lot to do with your knee stability, because the hip abductor is connected to the IT band, which literally are right where my stripes are, and then they connect on the opposite side of the knee joint. So they're good stabilizers. Exercises for this, we're going to show them.
So for beginners, you use no resistance. Now, we should say I do these with hip replacements and knee replacements, and the knee replacement people look at me funny because they don't feel it in their knee, but it's important to strengthen your hips as well.
You just need to have faith in us as therapists.
You just have to believe us. So what you're going to do is stand. You can use support, a walker, a countertop, whatever you need. And you're just going to work on kicking out to the side. Notice my toes are forward with this. We do not want to rotate our legs out. This is a different muscle group. So you're going to do 10 to 15 on one side. I also have a slight bend in my stationary leg, which is holding me upright. If you're really weak, you're going to sway like this. We want to keep that good posture. Once you do one side, do the other. And most people say my leg standing gets tired as well, and that's normal.
Right. So that's a really good point. And you just wanted to show your legs off.
Yeah.
I'm going to do it. You can get these loop bands if you have them. You don't need them, but I would put it above the knee, and then good posture while you're doing it. Again, toe does not point out like this, and not this, but this slow, meaningful movement, and you'll feel that muscle right there start to burn shortly. I can already feel some fatigue settling in, and again, slight bend on the weight bearing leg. And if you don't have one of these, you may have one of the bands like Mike is demonstrating.
Yeah, you can just hold the resistance band up, a loop band, whatever you have. You can even use a cuff weight. I've done that before at the therapy gym. Any type of resistance, a heavy boot maybe as well. We did have a question from Sydney who says, I hear popping sounds in my knee when stretching the knee. That's just like any other joint. So when you pop your knuckles, your back, anywhere, you have synovial fluid in every joint. You oftentimes get little air bubbles in there. That's normally the popping. If you feel it every time you move any which way, then it may be like crepitus or arthritis or something. But a lot of it depends on your age.
The rule of thumb is if your joints pop and snap and there's no pain associated with it, you hear it, it's okay. If you get pain associated with it, particularly consistently, then you may want to have it looked at and find out what's going on in there.
B asks if there's any exercises recommended for rotational movement in the knee. Most of your rotation is from your hip. It's not from your knee. Your knee is a hinge joint, so it extends and it flexes. There's not much play rotational wise. This is from your hip.
Well, with the exception of the screw home mechanism.
There is the screw home mechanism, but that's a locking out part. But there's not really a whole lot. There is an exercise we could possibly talk about later, but it's kind of interesting.
We'll get on to some things that are probably more applicable.
We better get back into some of our topics, and we'll get back to some questions. So the next one is actually tip number 6 is stretching your calves. Again, why does this have to do with your knee, Brad?
Well, the calf muscles, actually, the not the soleus, but
gastrocnemius.
The one that makes this little bump right here. Mine's getting smaller. I used to have cute gastrocs, and now they're falling apart as I age. But they do connect across. They're actually biarticulate. In other words, they cross the ankle joint and they cross the knee joint. So that muscle needs to be relaxed and stretched. If it gets tight, it can affect the mechanics, particularly with your full extension. So Mike has shown a nice exercise, easy to do. You can use a wall or just the handrails. There you go. Thanks for that.
Countertop, whatever you have. So all you have to do,
straight knee,
stand up straight. So in order to stretch your calves, you need to bring your toes up towards your nose like this. So to stretch them, there's numerous ways to do it, but one easy one is just standing. Hold this for 30 seconds and then switch sides. You can also use a wedge or slant board. Brad, I think there's one around here somewhere.
Oh, yes. I love the slant board.
Another good option is I like to do this one personally, is stand at the edge of a step, and then you just let your feet fall and your heels go down. If you notice one side is tighter than the other, what I like to do is lean towards that side more, and that gets so much more aggressive. Or you can do it single leg.
Yeah.
And I just do this for 30 seconds a couple times a day, and it kind of loosens up your calves. If your soleus is tight, to isolate that, what you need to do is actually bend your knee when you're stretching like this, and this will isolate the soleus a little bit more.
If you have an incline board, or if you want to get one, you can actually make one. We have a video on how to make one of these. I made this one. If you're a little handy dandy, you got some wood and some tools. It's about 12 inches long on the bottom, and the rise is about 6, and that gives you about a 23-degree angle, I believe, if I remember right, which I don't always. But the important part about one of these is you have to have a non-slip surface. It makes a tremendous difference, so that when you put your foot on there with the shoe, it does not have a tendency to slip down. If it slips, it's really pretty much worthless. Much better here. I'm exaggerating, but when you use it with or without, you will know. So now my knee is straight, gastroc, bent, and I'm going to go down here to get the soleus, and I can bend and use it.
Now,
like
some
that.
of those are wide enough you can do both legs on at the
same
time.
The double wide one, which I always like it, one just because I like to focus on it. But yeah, that's a good point.
Now, sorry to interrupt.
No, don't be sorry, Mike. That happens all the time.
If you are stretching your calves religiously and you're not noticing a difference, something you can try is a night splint, which is what I have on here. So this is not a splint you wear all day. It's at night when you are sleeping. You simply put it on while you go to bed. And what it does, notice it keeps my foot in a neutral position. It's not going to actually stretch me and bring me into dorsiflexion, we call this. So it's tolerable. Now, I've worn this before sometimes for like 4 hours, wake up middle of the night to use the bathroom, and my calf is just really tight and bothering me, so I will take it off. Some people recommend, if you happen to wake up middle of the night and you always know you do, maybe put it on then so your calves are loose in the morning. However, when I'm sleepy and groggy in the middle of the night, I'm not going to put this thing on personally. So I figure when I wear it, just put it on before I go to bed. There's tons of brands. They're on Amazon. This is just called Mars Wellness. It's just a brand, but it works pretty well. You just adjust it here. And yeah, it's a nice little contraption.
All right. Yeah, let's talk about walking with soft knees. Soft knees is simply a way for your gait or your walking pattern, so you minimize joint pressure through your knees, hips, and low back. It's simple, very simple to do. If you have some knee pain while you're walking and you change to this soft knee walking technique, you'll probably notice the pain go down a few notches right away. Mike is the master at teaching this, so I'll let him take over. Did you see anything? Any questions?
Yeah, Ray just made a funny comment. Hi, Ray.
What do you say?
Nothing. It's a family show.
Oh.
I know what it means. My mother's friends. That's what it means.
Oh.
Anyway, soft knee walking. So what we're talking about here is a lot of people, when they walk with normal typical shoes, they heel strike, they put their foot out in front of them like this, they land with their heel. Now, if you look at the direct line here, it's going to go ankle joint, then your knee joint, then your hip and your back. So the shock absorption is going to go directly into your joints. If you walk with more of a flat foot or a soft bent knee like I am, notice that there's not a direct line. This is because a lot of the shock absorption is going into your muscles. So it'll go into your calves and into your quads and into your glutes where you want it to go. Now, most modern shoes have built up heels, which make you want to automatically heel strike. So what we recommend is when you are at home, take your shoes off. You can use slippers. If you happen to have Crocs or something that's more barefoot friendly, you can wear those. But walk around with your normal gait in your house. And we want you to place your hands on your buttock and feel how much your glutes are engaging with your normal heel striking. Now what we want you to do is go the exact opposite on your tippy toes for about 10 steps, and you should feel your glutes engaging way more. So this is what we want to do, is engage our glutes, fire them, as well as our quads, versus putting it through the joints. But we realize most people aren't going to walk on their tippy toes all day. So just walk with a nice flat foot like this. You're probably not going to take as long of a step, and it will feel odd, but just build this up over time.
Right.
And I'm running out of breath, so please take over.
Yeah. And when I do this, it's very clear. When I land barefoot on a hard floor with my heel, I can feel the goosh, the impact. When I go this way and just touch with my forefoot first with a half-inch gap under my heel or about that, big difference. I feel like I'm walking on a cloud. That's why it's called soft knee walking, because you're literally having soft or little to no impact with the heel strike, or with the forefoot touching first versus the heel strike. I did want to mention something. I think it was Patty. It moved, but she had a question, and I thought, oh, this is an easy one. She talked about her kneecap being in the wrong position. Now, I don't know for sure if this is your situation, but most of the time when kneecaps in the wrong position, they go out too much. They're laterally displaced, and we need to get them to come in. So simply stretch it with a loose quad back and forth, and bring it in this way a little bit. And there should have no pain with this. If you do, then you shouldn't be doing it. And then to strengthen that, you take a ball. You put it between here, and we want to get the VMO, vastus medialis obliquus, big long term. This critical muscle will help pull the kneecap inwards, and squeeze and relax.
Do they have to yell it like that?
Yes, you have to go squeeze and relax. So 10 times with your toes pointed in. You're going to get your adductor. These muscles will get fatigued as well, but we're working on that VMO muscle to strengthen after you loosen the kneecap. Give that a try. Again, if there's pain associated with anything doing that, it means your kneecap is, or your knee is not ready for it.
No, just because we get asked in a lot of our videos where we're talking about walking, what shoes we're wearing, I figure we'll just talk about that quick. These are Witten. These are just an Amazon brand. They're like $45.
Witten. I call them Witten.
Whin. Witten. I don't know. Anyway, Zero drop shoes does not mean they have to be barefoot like Brad's. See how much cushioning I have here? It just means the forefoot to the heel is the same height off the ground, and they have wide toe boxes, which helps with the whole array of foot issues like hammer toe, bunions, plantar fasciitis. But there's tons of brands. We don't have an affiliation with any of them, but I switched all my shoes to wide toe box. Oh, those are Vibram. That's what those are. Huh?
These are Merrell.
Oh, Merrell.
Merrell,
okay.
yeah.
There's I own Ultras. There's lots of
I bought
brands.
these for running.
They all make pretty quality shoes. I don't have any issues, but these ones are relatively inexpensive if you're kind of weary about it.
And I think I just want to emphasize these are minimalist, very thin soles. For my feet, they're too thin. So I actually get the zero drop with a little cushion on the bottom.
And
I
can't really fold those too well.
Yes.
We did have someone ask a question about stretches they can do. All the stretches we showed earlier work just fine for what they were talking about. I forgot who it was, but any of these stretches we're showing work for all knee issues. It's not just one specific knee issue.
Joel from Pennsylvania, good morning to you as well. Sometimes it's just nice to say good morning.
Good. What if they're watching in the evening, though?
Well, that's why I wonder what time it is in the UK right now.
Well, you kind of. Oh no! We're gonna talk about tip number 9: avoiding knocked knees, or we call this genu valgus in the therapy realm. I think most people know what I'm talking about, but what's when your knees translate in like this. Now, what we want to do is try to get them straight. Obviously, some of it is genetic to a point, but the exercises we showed before where we did the standing hip abduction can really help with this option, or even external rotation, which I guess we didn't really get into. I guess we could do some sideline clamshells possibly.
There you go. Yeah.
So you can strengthen this and stretch them. A lot of the stretches we showed earlier in the video, like the hip flexor stretch, can help. Any of these hip abduction strengthening. This one, we're going to work on the external rotators, or rotating out from the body. So just lie in a sideline position, and then you're going to bring your leg out and back in, and you just do a pose like those old 80s Pilates movies that you could do. Right, Brad?
I was reading the thing.
I see that. You're
the clamshell. Yes.
Now, if you find this way too easy, you can get a resistance loop of sorts and put it around and make it much more challenging. So I'm going to go above my knees, and I'm going to do the same. Oh, God, that band is hard. So you're going to work on rotating out. You just want to make sure you have a nice straight line here. You don't want to be flexed too much because you're not going to get as much strengthening there. So just work on doing 10 to 15 reps on one side, and then make sure to turn over, and you have to do the other side. You gave me the hardest band ever, I swear.
Well, it's because I wanted to give you a challenge. I didn't want to have something anybody could do.
Yeah, this is a pretty hard band. So maybe start out with an easier band than this one. I'm struggling right now, and you don't want to rotate all the way over like this either.
All right, thank you for that. It was a good demonstration. Regain full knee extension. This is one that, particularly after a knee surgery or knee replacement, we want to make sure that knee gets fully straight. And I'll give you a nice way to test. This is my good knee, for example, and this was replaced or perhaps injured or after surgery like meniscus. Go all the way down. This knee is fully straight. I can feel it. It's good. Now you compare it to the other knee, and I go down, and let's go this way so you can see it. And this one's been repaired or injured, whatever. It's coming down. There's a difference. And if it's that much of a difference, that's the difference. We want to get even if possible. So you don't want to get too aggressive and have, your 13-year-old sit on your knee to get it down. It's going to hurt.
What about a 14-year-old?
Yeah, or your 2-year-old. But really, seriously, you want to actually put your hands above the kneecap and gently push down. It works good on a stool like this. Push down and give it a little gentle stretch. 5 to 10 repetitions. And then if it's the first time you did it, you felt stretching in the knee, give it a break, see how it feels the next day. You might be surprised because you have sore knee. That means you did it too aggressively, and don't do it so hard. If it feels fine the next day, you can go a little more aggressively. And the goal is to stretch things out to get to that straight knee. Again, Mike, do you have some input?
There's a couple variations. So if you're doing that and you don't feel like it's necessarily tight, but you're just weak there, what you can try is terminal knee extension, or TKE, we often call these. So you can do this numerous ways, but one way you can just sit on the edge of your bed, put a towel or a small squishy ball under your knee, and focus on driving the back of your knee into that. Your foot may even pop up a little bit, and you're just going to hold it for 5 seconds. And then you're going to relax, and you can do that 10 times. You can also do this standing with the band behind you. Often we have TheraBands, not little loop bands like this. But you can put it right behind your knee, let your knee bend, and then just work on pushing it back straight. So if you're really lacking that extension, that's an exercise you can try. But one thing I found beneficial for people, especially after a knee replacement, and they had really tight hamstrings before surgery, we're talking like years of tight hamstrings, is to lay on the edge of the bed.
Oh.
Now, some people, you may have to put some more pillows because your knees may be sensitive, but what you do is back up all the way to your knees are at the edge, and you let them dangle. And then gravity is going to pull them into extension. And oftentimes if people are real tight, they'll be like up here almost. So we'll just let them hang, and then we've even thrown cuff weights on their ankles sometimes, and we just make them sit here for like 5 minutes.
Be careful with this one, because you want to have your kneecap over the edge, because it's uncomfortable if the kneecap is on the bed or the top there. And again, don't start with weight on your foot right away. Just try it without any weight. It may only be tolerated for 15 to 30 seconds. Eventually, it can get more. Again, if this really hurts, you're going too aggressive, too much. It should just be a comfortable stretch, maybe a little uncomfortable. Do not get too aggressive right away. Be nice to your body.
And if you don't have a cuff weight or something, you can just put a heavy boot or shoe on that foot as well to help pull it down. Just something to add some more weight, and gravity will take care of the rest.
I did want to mention to Lydia, she talked about having meniscus, it sounded like surgery, quite a few years ago. This is one thing I would see if you are getting full extension on both knees. It may be something that you'll want to work on. Again, don't get too aggressive, but get those knees at full extension can be really critical, particularly after surgery like yours. Also, check the bend too, but I think we've got that coming up on another point.
Lydia said she has not had surgery, but wondering if the same exercises as when you're done. Yeah, the exercises remain the same with or without surgery. You're still trying to strengthen your knee and get the motion back. So everything pertains both ways.
Maybe there's another Lydia. I could have sworn she said she had surgery.
After surgery, you have precautions for a while you have to follow, but just tuned in, he covered it, but healing after torn meniscus in both knees from 9 years.
There you go. That's the one I was talking about.
Is there 2 Lydias in here?
Well, there's 2 Brads in the world too.
It's the same one.
2 Mikes, 3 Mikes.
I've never had.
Yeah. That one is kind of hard to address because it's surgery. It's 9 year status post, and so it's hard to really give you confident advice.
Do revert. Danny, go back down, please. Sorry, our mouse isn't working. Danny is our mouse right now. I do the reverse clamshells where I push up. I can't read it now. From the ground. You can do that too. So reverse clamshell is just kind of almost like a side plank. And you can just do it this way as well. That's what he's talking about. Okay. You can also, I've done it here, and then I have a band, and I do clamshells while holding up, but that's really advanced. If you're having knee pain, this probably won't feel too good, but this is a fine option as well. Yeah.
This is for a pretty athletic person if you can do that, but there are people like that. We want to help them out. The next one is foot strength. Can we go down to the floor here, Tanner? Look at those nice socks, huh? Look at that.
You could use toe socks. They'd be cooler then.
See, got the L on
there. I don't even
there.
have my toe socks on today.
Then I know it's for the left foot. But seriously, this is a nice sock because it shows when my foot pronates. See that? A lot of people's arch is not stable and it pronates. So what you want to do is put weight through it. And I'm going to, with weight, I got to get a stick. There we go. Take your walking stick or whatever you have. And then I'm actually going to go up like this and pull. There. And you can go up on your toe, but the idea is to get the idea that your foot moves like this and strengthen the muscles. 10 repetitions like this, just to turn those muscles on and get them strengthened up. And this exercise you'll want to do on a daily basis, maybe twice a day once you get used to it. I can feel right in here in my arch, a little fatigue already just from what I did there, but do it with weight bearing and work on that and see how that works to strengthen the foot. You got another one, Mike? Oh,
Actually,
yeah, the towel.
Interviewing Dr. A. McClanahan, who's a podiatrist we've talked to, he talks about a lot of people may not even have flat feet, actually just have weak arches and weak feet. Now, there are some people that actually have a genetic predisposition, but a lot of people just have weak feet. And like we talked about, the zero drop shoes naturally strengthen your feet because they have to work harder and there's less support. If you have too much support from your shoes, your feet get weak. Just walking around barefoot can help in your house, but gradually build that over time. But a way to also strengthen your arches, I have high arches. We can see here, if I had flat arches, my foot would be way in like this. I can't even flatten them. They're too
You got a pretty
high.
stiff forefoot there. You better work on that.
But what you can do is some towel scrunches. So this works a little bit better not on a carpeted floor, but you basically just curl your toes and you just work on pulling the towel closer to you. Notice my heel is staying on the ground. Just make sure to wash your towel afterwards. Don't wipe your face with it because it might smell. Otherwise, some other things you can do is if you have dice, marbles, a golf ball is a little big, but you can work on picking up stuff with your feet, because notice this engages my arch when I curl my foot like that. So I grab it and then give the stinky ball to Brad.
Oh, no. Dice work good for that too.
Yeah, that's why I said
you did
dice,
say that?
marbles, whatever you have.
I think they're called,
they're little.
If it's plural, it's die, not dice.
Or is dice plural and die singular?
That's a good, maybe someone can help.
Yeah, let us know about dice and die.
Sure,
we're not very
English major.
There's probably some gamblers out there.
All right. Let's go to the next one.
I will, but I can't figure out where I am right now.
Well,
where are we?
11.
Oh, strengthen your... No, we're on 12. Strengthen your core.
Ooh.
Do you want to talk about this?
Well, this is one of those things that's like, well, what does the core got to do with your knees? If your core is weak, and this is related to the hip abductor exercise, the core, the muscles here, if your pelvis is not stable and you start walking kind of weird like this, that can put pressure and make the knee want to go in. So core is indirectly related, but it's such an important exercise for so many other things. You can't go wrong with core exercise. It's going to help your hips, your knees, as well as all the way down to your feet.
So your core involve your ab muscles, your six pack, your transverse abdominis, which is really deep underneath and helps with big, deep breathing. Also your obliques, your hip flexors, your butt. It's everything. It's everything. So there's a lot of different ways to strengthen your core. It all depends upon what positions you can physically get into safely. I know I showed glute bridges right away in the video for hamstring strengthening, but that's a great core strengthening exercises because it gets a little bit of everything. You can also do, Stuart McGill has the big three, but I don't know if we want to get into detail of all of those right now because I'll take a minute. But just doing bridges like this is good core because your abs are engaging, your glutes are engaging, your hips are engaging, and it just gets everything all at once. If you're just going to pick one exercise to strengthen your core, this is a pretty good one. If you're stronger and younger, you can just people throw barbells on, and they also throw kettlebells on their waist. They'll even do them from this position on the edge of a mat like this. And any of this stuff works well.
I'll give an example that you can use. I like using this ball. I got this from that
Bender ball.
Yeah, the Bender ball.
Leslie Bender.
So you got a squishy ball. And you want to think about your feet. Get them so they're not flattened in. We talked about that already. And then take the ball, bring it up, squish it. Opposite. You could do the same one.
Oh, that's pretty good.
Squish, squish. And now we're going to go a little bit wider and we're going to do a cross squish. And that's going to help get those. Oh, oops. There goes my Mike. I'm good, he says. All right. Squish this way. And this is nice because it works balance, it works the feet, it works the hip flexors, and it works the core. You're really getting a complete, universal and comprehensive exercise with the ball.
I'll go to a question. Ovidia Thomas says, I may have a knee replacement. What can I do to have the best outcome? Do your exercises after therapy. Some people even go in before they have the surgery. We call this prehab. They'll maybe just do one session and do them at home, or they may do it for a few weeks. So after a knee surgery, the main focus right away is just working on your straightening and your bending. This is common with any knee surgery, whether it's ACL, meniscus, anything like that. They all pertain. But just work on your bending and straightening right away. Eventually, strength will come and your therapist will progress you. But just walking Possibly riding a recumbent bike or a new step of sorts is good. Whatever you have available. Brad's got a device right here that can work prehab and post.
Right. The prehab, very important. We do have videos. If you go Bob and Brad knee replacement prehab, you'll get a video of exercises to do beforehand, or a lot of surgeons require you to have a meeting a few weeks before.
We actually have Alex and I did a whole knee replacement program video. It's for free. BobBrad.com. Go to the program section, look knee replacement. You'll find all the recommendations.
This device here we developed specifically for knee range of motion, works excellent for knee surgeries before and after, and you can work it. It has a nice little handle on it that works as a stilt, so you work opposite muscle groups. Here we're focusing more on the quadriceps, and you're going downhill to get more of a bend. You can also bring it this way. This is really nice in emphasizing the hamstring strength after surgery as well as before. You certainly don't need this. You can pull a towel on a smooth floor. Doesn't work quite as well, but it works good. You don't get the incline option. But this is the knee glide. We do have that in our website, bobandbrad.com. All right, let's go to the net. Oh, Mike is preparing.
I am. I want to be prepared. Right. So the next suggestion, what tip are we on? I can't even read.
Heat or ice?
Heat or ice. Oh, third. Thank you, Danny, for highlighting it for me. So heat or ice. Now, many people ask us which is better, and our answer is it depends. So if you just had surgery or you just had an injury that's acute, meaning within the last couple of days or even week, you have a lot of swelling, a lot of inflammation, ice is going to be your friend. Especially after surgery, you're probably going to be just using ice for a few weeks. Now, some people, even after like meniscal surgery, ACL, total knee replacements, sometimes they still have some swelling, but their muscles around the area are super tight and causing some discomfort because they're guarding against that pain. So in that circumstance, I've actually used heat with people, but I'm not going to put it directly on the knee joint itself. I'm going to maybe do the area that's tight. So some people it's the quads, some people it's the IT band, and other people it's the calves or hamstrings. So apply the heat where you feel the tightness, and you can use it that way. Now, if you just have arthritic knees in general and you haven't had surgery, heat is probably going to feel a lot better than ice.
Right. This is an example of a cold pack. So make sure you get a nice cold pack that's gel, and when you pull it out of the freezer, it's still pliable, but nice and cold. These are nice if they have one that has kind of a cloth lining. If you don't have that, make sure you put it on over your pants like this, versus directly on your skin, because a cold pack, it's below 32 degrees. It could do some superficial frostbite on your skin. Avoid that. All you have to do is have a layer of cloth or pants, put it over, and the flexibility is really important so you get contact. If it's like this is one of those stiff cold packs and it's like this until it gets warmed up, well, you're missing all the benefits on the cooling the knee down all the way around. So you can go like that. You can come underneath. I oftentimes put two on, one here, and then I'll wrap the whole thing with a ace wrap or something of that nature to keep it on. And then voila. Oh, what do you have, Mike?
Now, I just have a heating pad, and this one actually says Bob and Brad on it. So you can use a heating pad. This is one we sell. We have numerous versions. We have ones that are more you wear on your back. This is just a nice square you can use on any body part you want. Comes with a couple straps. Does not come with the cool blue tape. That's just to hold the label out of the way. But anyway.
The big advantage and the reason why we put our name on it is because we test our products prior to putting our name on it. And my big advantage to this is it's weighted. When it's weighted, all you'd have to do is allow the weight of the pack to wrap around. It's comfortable when you have slight weight on your body. The tendency of the body, as long as it's not overweighted, which this is perfectly weighted, it makes you relax. You got heat, you got some weight on there, you got good contact, and it's just a nice dimension so you can get all the way around the knee. As you can tell, they can take the elastic strap, wrap it like Mike mentioned. It works good for the ankle, for the hip, for the back, for the elbow, pretty much a whole body.
Yeah, and you can adjust the heat on it and the timer on it.
Yeah.
Automatically turns off. It's pretty handy, and you can even wash these, correct?
Yeah, you just pull that off and throw it in the wash machine, and
hit Brad with it.
Which I thought you got to be kidding me, and sure enough you can. So if you're eating while you got your hot pack on, you make a little mess, it's okay.
Are the exercises for an untreated ACL injury? All the exercises we're showing can be done with any knee injury. With an untreated ACL, you're obviously going to have more laxity in your knee. You're going to have more translation. So as long as it's not causing pain or instability, or you feel like you're going to fall over or injure yourself, they're fine to do. You just have to kind of let your pain and stability be your guide. What are you doing now?
Well, if you have an ACL injury, almost always it's important to have a dominant hamstring strength. So this is a good way to get hamstring strength at home. It's hard to do hamstrings, but this is a good way with a band like I'm using here, all seated, and isolating that. There's other ways too.
Yeah, a lot of it depends upon, I'm not sure how old you are. Like if you're younger,
62.
Well, not you, the person asking the question, because it's not a knee replacement. I can guess that age. The Nordic hamstring curl is really good for athletes for lengthening and strengthening your hamstrings at the same time. You mean
the one where you go like this?
Yeah,
that's pretty aggressive.
You have your feet locked in. So if you're younger, an active person, that's a good one. If you're older, that's not as easy.
Or if you're younger and not athletic, you're probably not going to do it.
Oh, he's 60?
Yeah.
Well, the one Brad showed is fine then.
I think so.
Yeah.
I won't do the Nordic hamstring one because I'm afraid I'll pull my hamstrings apart.
All right. Our next tip is to reduce stress on your knee joints is actually just maintain a healthy body weight for you, whatever that is. Obviously, the more you weigh, the more pressure is going to be on your joints, which is going to eventually wear them out sooner than later. So just maintaining a health. I think most people know this, but
yeah, it's one of we can just. I think we'll go on. We don't have to get into detail.
Tip 15 is to massage the areas around the knee to actually loosen them up. And we can show numerous ways to do this. You can just use your hands if you want to. However, oftentimes your hands are going to get tired. I don't really use my hands too much unless I'm out and about and don't have anything else with me, but you can work your quads, your hamstrings, your calf muscles, your IT band, whatever. However, there are many different tools you can use, which I find more beneficial.
I think we should mention the popliteus that Rick Olderman talks about. There's a thin muscle right back here, right? And then the hollow of the knee right there. And you want to actually get in there. That muscle can get tight. And you can do that by hand and work on that and get in deep, even though it's a fairly superficial muscle. You still got to get some pressure in there. So if you're like, in your 60s, your fingers will probably be getting a little sore after a minute or two, and you just give them a break, or you use a massage gun or a ball like he's going to demonstrate. Mike is.
So some options of things you just may have around the house is some sort of ball. A tennis ball would obviously be softer, a massage ball, a lacrosse ball, anything you have. A softball is quite firm, so it's going to be more aggressive, but for filming purposes, I'm going to use this because it's big and orange. So put it on the area that's bothering you. You can, if you do this on a bed, it's going to sink too much, so you need a firm ground. I have some tight hammies there. So just rolling on a ball like that can work just for stuff you have around. This is nice because once you're on the ground like this, let gravity help assist with it. Notice I'm using my other leg to help support and take weight off this. I'm not just like this and rolling because I'm not going to get very far. So use your other leg to help. You can get the hamstrings, you can go on the IT band. Oh God, this is real aggressive on the IT
careful
band.
Mike.
You can work your hip flexors. You can go any which way on this ball.
Be really careful.
You can work your calves as well.
Yeah.
So just do your calf region. Now, that's just an option because most people have a ball around and it's free. But if you happen to have a foam roller, you can do all this stuff. You can do one leg, double leg, whatever is more comfortable for you. But I like a foam roller. I have this exact one in my house.
Yeah, they are easier. You can do a lot with a foam roller. We have exercises for just foam rolling as well, and Bob and Brad. But yeah, for this purpose, much easier, a little more comfortable than this.
Yeah, I can roll a lot smoother too. And there's different aggressiveness to them. Some of them have nodules. Some of them are softer. Some of them are firmer. It all depends upon the pliability of your muscles and what you feel comfortable with using. Some of them even vibrate nowadays.
Oh, yeah. Yeah, we got one. I like those for my back.
Yeah, I'm just going to keep playing with this.
If you have a massage gun, you can do that. anywhere around your knee, make sure you use the airhead that's soft if you're getting close to the bone, which is very common around the knee, or the round head. I would not go anything with like the bullet head, would be too aggressive. I want to talk about one thing in particular that I have a good example of. If I'm working that popliteus muscle and I just pulled my pant leg up so you can see it, otherwise you can't see with the black head on the black pants, but I'm going to work in here and get that in here. I'm not going to get too aggressive. You have an artery, you have a vein in there, and you have some nerve bundle all in there. So work it. If you, with the advantage of the round head is if you go straight in, that's pretty aggressive. Turn it 90 degrees. It's not as aggressive. It gets a little cross friction massage, which can be very beneficial. Now, pay attention to your legs. Can you get a close up of this? If you have beautiful legs like mine that have these ugly varicose veins, don't massage on your varicose veins. You can try it if you want, but I don't do mine because I don't want to injure them or have a rupture. Just notice, I don't even know I have these until my grandson came over. You got big muscles on your leg, and here my varicose veins were bulging. So anyways, be careful around those. Older people, it's not uncommon. My doctor says I don't have to get them worked on because they're completely asymptomatic, no pain when I run or exercise at all, but I'll probably take care of them someday.
Karen had asked, I have low back pain and hip pain. Karen, in this video, we're just talking what's knee pain. However, a lot of the exercises, if you rewind the video, you can do that while it's live. We show a bunch of hip strengthening as well as back strengthening exercises because they relate to the knee as well. So you can do any of those as long as they are pain-free. Anyway, let's get on to the next tip. Now, if you are having a lot of knee pain while walking and you are older or middle age and it's not getting better, then it may be time to use some sort of assistive device, perhaps just temporarily. You don't have to use it long term if your pain subsides. So you can use things like walking sticks, a cane, or even a walker because it just helps take some of the weight bearing off of your joint itself. Brad's got the whole array ready.
Oh,
here.
yeah. Now, walking sticks are not going to take a lot of weight off of your knee joints, but sometimes just a little bit can be enough to make your knees feel better. It helps your balance, and that can really take stress off as well. Not only just physically, but psychologically, you will be more stable and makes you feel more relaxed. So that's good. A cane, Michael, talk about.
Yeah, but a walking stick everyone uses, so you can still look cool at any age.
Well, that's true. I don't never look cool.
Now, you just said you had cool varicose veins. Anyway, now with a cane, what you're going to want to do is put it in the opposite side of your knee. Even if you're right-handed and say your right knee bothers you, you're going to have to use it in your left, because what you want to do is when you sequence is bring the cane with the foot that is painful. This is going to help offload some of the pressure in your knee joint here when you're walking. And again, you do not have to use this long term, but it can definitely help. I believe Bob's wife even did this for a little while.
Actually,
she was reluctant. She used crutches.
She used I don't know if
she was younger,
2 or 1, but you can use one if the left knee is the involved painful knee. The crutch should go with the right arm, and they work together. Same concept. A lot of people may want to go the same right foot and the right hand crutch to go on, and it does unload it. You should go the other way. You're more stable when you walk.
Well, when you think about your walking pattern, you don't swing your left arm and.
Well, I do sometimes.
Do you walk like this?
No, I don't.
Yeah.
I'm just kidding.
Another option, if these are not helping or you feel unsteady, or maybe you're already using a cane and it's not helping, any type of walker can really unload the pressure for a while. I mean, if you get to this point, and it keeps getting worse, you may want to get your knee checked out.
Right. Make sure there's something other you can do. But stay safe. The walker can keep you from falling. That's obviously very important.
And right now we're having more technical difficulties on the board, and I can't see my thing. Danny, please reconnect that. I'd appreciate it.
Well, it's going round
perfect.
And round.
It's back.
Thinking.
So a walking cane, how do you manage with 2 painful knees? Well, that's when you're going to use the walker.
Right. Walker, maybe the crutches, depends on
walking sticks, you'd get both then.
Yeah.
So
yeah, you can. Walking sticks, again, don't unload the weight through your knees as much, but you have stability, which can, again, like I mentioned, be helpful.
All right, our next tip for knee pain is
the bike.
Is gradually adding resistance training into your routine.
Well, we talked about that with our resistance bands and stuff.
Well, we didn't just mention it as a number, so I'm talking about it.
Well,
so
we got
a lot
extra.
of people that have painful knees, once your pain isn't as bad, strengthening is important because oftentimes people have really weak knees, and more often than not, your painful side is going to be weaker than your dominant side or non-painful side. So doing any type of strengthening exercise for your legs is going to be beneficial, whether that's laying down, doing supine ones on your back, if it's doing one seated or standing, just getting some general strengthening is going to be good. And you want to get it stronger because oftentimes people have less pain when their muscles are stronger.
So I think that segues right into the bicycle.
I should say it's important to focus on single leg exercises because if you're doing both legs at once, your dominant one will still take over.
Ooh.
Anyway, we can talk about the bike now.
So the bike, put it on low resistance. It gives you range of motion in your knees and you're stable. You don't have balance issues to worry about. This is too low. You want to make sure the seat is high. It's high enough. And I don't remember.
It's right underneath you, right in the front, I believe. Is that not it?
Nope, that's not it. Anyways, I haven't used it for a long time.
Sit on it. It's on the side. Is that not it?
There.
There.
That's better.
You're already low.
So get to know your bike, of course. And now I remember it. I haven't used it for a while. Now, the resistance on a stationary bike can be really beneficial because after you've gone like this with no resistance, things are feeling good. You can add a little on this one. There's usually just I went 2 clicks. Yeah, it went up a little bit. I think I'll stay there for a day or two. If it still feels good, I don't mean you're going to go 5 or 10 minutes. Add the resistance as appropriate. You should feel comfortable with it. Get your legs to fatigue a little bit and work that as needed. I always like to go low, get some resistance for maybe 5-minute workout, whatever you're doing, and finish with really low resistance without pedaling fast. Just nice, gentle range of motion.
Lydia asked, can you talk about number of repetitions and how long to hold stretches? With stretches, typically 15 to 30 seconds, 2 to 3 times is the adequate amount for each side. With exercising for muscle hypertrophy, often it's something in the 8 to 12 repetition range is sufficient. Oftentimes we do
What's hypertrophy?
2 to 3 sets. Hypertrophy is muscle building up strength. Strength building is a little bit different. We don't want to get into that here, but just building up the overall muscle size is naturally going to build up the strength. Typically, if people really want to do strength, they do 5 times 5, but if you have a painful knee, that's going to be too much weight, not feel good. So we recommend, 8 to 12 repetitions with each exercise. And that works with weights, machines, bands, anything.
Mm-hmm.
Body weight as well.
Oh, what do we got?
Someone says, why does my right calf hurt when descending stairs, but not when walking? Well, I'm assuming you're going through a fuller range of motion because we kind of talked about descending stairs earlier, even though we're talking about knees in this video. But if your calf is hurting when you're going, I'm guessing it's the calf on there.
But I'm guessing I was thinking it would be the one that's going down low. I guess we are taking an assumption on
I'm thinking it would be this leg.
It could be.
I'm assuming you have some tight calves, so you can't get into that motion because this is probably your soleus.
Sure.
Because your knee is bending. Yeah. So I would stretch your soleus. So you have 2 calf muscles. The gastroc you stretch with a straight leg. The soleus you stretch with a bent knee like this, and just work on holding that. You probably have some ankle tightness as well. So I would look at that.
Yeah. So look at one leg compared to the other. You'll probably notice when you do the same stretch, the one that has painful is probably a little tighter than the other one. So it's a nice way to do it.
Scott says it's weird watching us in real time because he normally speeds up 50%. So I guess we'll just start talking a little bit faster. Our next tip is don't rely on medications or injections to fix your knee pain. Now, some people, if maybe they're younger or they're not too arthritic in their knees, they can get an injection. It helps temporarily, while they start doing some more exercising, strengthening, stretching, and then helping restore that full motion as well as building strength helps take their pain away long term. However, if you just get an injection and do nothing else, you're probably going to get your pain back. It's basically like a Band-Aid. And the same works with Tylenol. Most people know it has a certain amount of hours it works and it doesn't work, and eventual long-term use of that can lead to a whole array of issues.
Yeah, now if you use ibuprofen, which a lot of people do with inflammation and swelling, this is, I had an appointment with a physician and I was having problems with my back at the time. And I said, I don't like to take a lot of pills, even ibuprofen. He said, do this. For me, I could take I could take 600 milligrams, 3 ibuprofen with food 3 times a day. And he said, do that. Take it 3 of them 3 times per day with food. Do it 3 days in a row. And if it doesn't do anything after that 3rd day, it's not going to help. Quit taking it. Long-term use of these NSAIDs or ibuprofen is something you do not really want to do. It's hard on your stomach and other internal organs. That's why you have to take it with food, because we want to make sure it's diluted slightly. That might not be the right term. Sorry, pharmacists. But anyways, that's how you want to do that. I think that's a really good, safe rule of thumb if you're using ibuprofen. And also, he said, if after the first day it's feeling pretty good, he says continue taking it through that 3rd day, because there's continued healing. There's still some inflammation in there. Finish out the 3-day cycle and then stop.
Now, obviously, we're not registered dietitians, but looking at your diet can really have an effect on the amount of inflammation you're feeling in your body, whatever that is for you. But just look at that. It's a good idea, I believe.
Yeah, I think a lot of people blame things on sugars.
Yeah, they do.
Keep the sugar out of your
Nick
diet.
P says, what's up? Hi, Nick P. This is what's up. We're talking about knees.
That's
anyway, our next tip is, can you still have knee pain after a total knee replacement? And the answer is, it kind of depends. I've had some people, oftentimes right away, you have pain because you just had a large incision done, they put in a new replacement. But once that subsides, like 3 to 6 months later, most people are feeling better and they have less pain because they were dealing with so much joint pain before. However, some people don't always stick to being active or doing their exercises or stretches, and they become weak again. And sometimes the muscle tightness that you had before the surgery is still there, and that can be causing some of your pain yet. So you may not have knee joint pain, but you still have pain in the surrounding areas. So it's important to keep doing your stretches, exercises, or figure out what's causing your pain if you're having it even after a replacement.
Use good judgment. If it's after a surgery and again there's continued pain, you need to get back to your therapist or call your doctor in case there's something going on. If there's any redness or it's getting warm, immediately call your doctor. You want to make sure avoid any kind of problems, for example, an infection, and they'll talk to you after surgery about that in detail. But remember that stay after it until it's all done and well and with a professional help.
I actually just saw a lady for a tune-up who's in her 80s, but she had a hip replacement. But about a year later, she was still having some pain. She had some tightness, and we just kind of stretched her and exercised her out. And now she said she wasn't doing very much at home.
Well, it's winter time. She was
walking laps with her walker. She got a nice house, she told me.
Oh, that's good.
And we already talked about our last tip. I guess we can go through any more questions, Brad, if you see anything. Great.
We forgot to mention at the beginning of the video, next week we're going to talk about shoulders. And there we are. We're talking about shoulders. I like looking at myself over here, Tanner. Anyways, we'll be here at 10 o'clock Central Time talking about shoulders. And should I mention about the chat thing? Yeah. So we're going to start 10 minutes before. Is that 5 minutes beforehand? If you want to we'll talk about anything. If you want to ask us what we do in our spare time, we might tell you, or anything fun just to get to know each other.
Nothing about my spare time.
Yeah. Well, I wouldn't either if I were you. So anyways, next week is the shoulder. Was there anything else we want to address?
I don't know. Bob's saying something, but I can't hear him on the phone over there.
Yeah, Bob is with us. He's at home. We're Skyping or Zooming or whatever you call it, but we're having a bad connection with him.
Bob's repeating for us. Yeah. I don't know what he's talking about. Brad, tell me a story while we figure out what Bob's saying, so the audience is
well. As far as the shoulder goes, and that's going to range from impingement if you're having problems lifting up or behind, or very common problems with the shoulder. Frozen shoulders, we'll talk about that a little bit as well. Strengthening as well as stretching, and everything works together. We've got some really good tricks on the shoulder that are simple you can do at home.
Already did.
What was the comment?
He was saying talk about the massagers.
Oh yeah, we did. Anyways, as far as the knee, I think we talked about the soft head, the round head, the air head.
Yeah.
The size of the massage gun. If you're a thin person, a smaller person, this is the gun I recommend, the Q2. If you're a larger person, you got some big hamstrings and quads, look at those massive things I've got there. I'm just kidding. But anyways, a bigger gun like this or like this for some people may be what you need. Again, this is more for that larger person, athletic, a lot of muscle.
Yeah, this is a Q2. They have some of hot and cold heads as well. That's the C2 Brad is holding. They work definitely, but obviously you can't go right on the knee joint itself. It's not going to feel too good.
He means with this hot and cold head.
Yeah. But I would say, Nick P has a question about bone remodeling. This isn't really our expertise, but if you're talking about remodeling bones after osteoporosis, you can check out Sarah Meeks. She's much more into that than we are.
Well, yeah, she is the expert at osteopenia or osteoporosis, yes. All right, well, I'm getting tired, Mike, and we have another video to do yet.
Yeah, we have more filming to do. So thank you for joining us. We'll be back next Tuesday at 10 a.m. Central Time.
9:55.
Sure, 9:55.
If you want to come in for a short little chat on the shoulder again. Be careful, be safe, and once again, we can fix anything except for what, Mike?
A broken heart.
A broken heart, right? And we're going to work on that. Any suggestions next week will be happy to have them. We may not follow them because we've already tried, but we're going to get to it. Have a good day and be careful.
I heard mental therapy.
Bye. Bye, Santa. Goodbye, Beatrice. Goodbye, man known only as Jeff.
Renee
I like that.
Tired.
The man from Glad. I like that one.